But today we are here to flag off drugs to our 121 facilities across the county, plus our 6 sub-county hospitals worth 80 million. These are drugs that will carry, will be a supply that will last us all the way to December or up to mid-January. But I want to thank my Department of Health. I think for the last 2 years we have been consistent with supply of drugs in our facilities, and we've never had challenges of shortage of drugs in our facilities. While others are still on strike, in this county we are happy to report that we are going on with our work. And we want to urge all our health workers in all our counties to really go back to work, because county governments have not refused to effect any salary increase. It's only that we are also following what the Constitution says, that the only institution mandated by law to deal with issues of salaries, remunerations, and benefits is the Salaries and Remuneration Commission. And therefore, let's allow that institution to engage with Council of Governors and the union so that we can solve that problem amicably. We also want to say that part of these drugs, we have another consignment supported by the Global Fund, I think worth 130. You remember there are drugs that we give free in our facilities supported by the Global Fund. And part of the drugs that are going to be supplied are also that supply from the Global Fund. And we value that partnership, and we want to tell Minister of Health we shall continue working together in the spirit of cooperation. We are putting in a strategy where we want to strengthen our ground movement in terms of our community health workers, because a majority of the diseases can be prevented. Remember, malaria used to be a serious killer disease in this county. But when a serious program for mosquito nets and prevention and sprays was carried out, we have had minimum relapse of malaria outbreaks in the region and in the county. Our emphasis going forward is to work with community health workers, volunteers, and our public health department, strengthen our public health department to ensure that hygiene and all those diseases that can be prevented can actually be prevented at that level. So going forward, you will not see us doing a lot of construction of so many facilities, particularly health centers and dispensaries. Our focus will be completion of the sub-county hospitals and equipping, and more resources and time will be allocated to preventive measures.